when people come to see me in my office, I'm treating their pain by helping them mentally, by saying, look, you're going to get better.
Welcome to the Council of Dudes podcast. I'm your host, Vinny Brusco. I am a father, a husband, the founder of Agora Social Club, a purple belt in Brazilian Jiu-Jitsu, a certified life coach, and a facilitator of the Council of Dudes men's group. This podcast is here to help you tap into and follow your golden thread, that feeling that pulls you forward to become the best version of yourself. If you're someone who's into personal development and self-help and is looking to live a life of more alignment, then this is the podcast for you. Subscribe to the channel, click the notification button, and follow along on the journey of the show.
Hey, it's Dr. Stephen Thorp. You are checking out the Council of Dudes podcast.
And here we go.
I don't have a formal introduction.
All right. I don't have one either. So.
First off, I want to just say thank you, because when I came to see you with my back issue prior to the cortisone shot, we were talking, and obviously the serendipities of life started to play themselves out, and we had a lot of commonalities and connections, jiu-jitsu. And one of the first things you said to me was, my goal is to get you back into jiu-jitsu.
Yeah.
And I feel as though, had I gone to maybe, and correct me if I'm wrong, 9 out of 10 other doctors, it would have been a very different sentiment.
Yeah. I mean, we hear that a lot. Yeah. Yeah. I mean, that's my goal, right? My goal is always to get people back to what they love doing. I think in medicine in general, and I was trained this way through medical school, it was, this is bad for your back. That's bad for your back. You shouldn't do this. You shouldn't do that. But I think, the research has played it out differently, and my experience has played it out way differently. And you start seeing, hey man, if you come to me and tell me this is what I love doing, I'm never going to say don't do it. I mean, that's the wrong answer. We have to find ways to get you back to doing what you're doing. We may have a long rehab process. We may have to do X, Y, Z, and it's different for everyone because everyone's an individual, but we're going to get you back there. That's always the goal. And so you're a jiu-jitsu guy?
Yeah. So you're a jiu-jitsu guy, so you know the importance. And you said, I'm not going to tell you not, because I know that's not reality for you. Like, you're not going to not go and train. And you made that very clear. I was like, all right, good. This is the guy.
Yeah. Yeah, absolutely.
So how were you trained? Because how many back surgeries have you done at this point?
Boy, I don't know. I've been out of fellowship almost 10 years. So I'm a minimally invasive pain physician. So what do? We do minimally invasive procedures and surgeries for people with back issues. So whether it's a lumbar disc related issue, a facet issue, sacroiliac joint, whether you have a fracture, the procedures are all different. But over those 10 years, I mean, thousands. I don't know.
So how are you trained? And then what made you shift your mindset into the unconventional way? Because you see this more in, I think the culture now is shifting away from conventional medicine.
Yeah.
Whether it be mental, physical, spiritual, there are these new shifts and waves of how people are approaching their health and wellness. Yeah. So how were you trained versus how you are now?
Yeah. I mean, so we were trained, there's a problem, fix it. There's an anatomical problem. You got to fix it, right? So you have a disc out, maybe you need a discectomy. You have the bone slipped, maybe you need it fused. You have whatever it is, right? There's an anatomical fix for that. And there's truth to that. Of course, these approaches all work. But we started seeing over time who's doing better and who's not, and I think the more active people are being, the more that they're doing, they tend to do a lot better. I came from a background of sports. I am as amateur as it gets at everything.
Right.
I'm a super average guy, but I've always been in sports, always been in athletics. I can't imagine someone telling me, hey, you can't run anymore. You can't go on the mats, you can't do that. And so getting people back to doing what they love doing was always something I wanted to do. And I started doing it and started having great results and started seeing that, I was wrong in a lot of this too. When I came out of medical school, my first couple of years, I would tell people, hey, look, you got this L5S1 issue. You really shouldn't be deadlifting. You really shouldn't. Man, I was so wrong. I wish I could go back to those people and tell them, hey, I was wrong. You should be doing that. You should be getting strong in these positions. So I think it's over the years, being flexible, seeing what works, having experience, seeing what doesn't, and being able to say, hey, maybe I'm wrong on this. Maybe there is a better approach. A lot of it too is like, you're jiu-jitsu MMA guy, early UFC, it was always judo versus boxer versus Muay Thai guy versus sumo guy, right? And what we do was a lot like that too. It was like the surgeon versus the chiropractor versus the physical therapist. Like everybody had their own modality and their modality was best. And this is what you need. And so we started saying, you know what, maybe we'll take a little bit from this, a little bit from that, a little bit from here. Maybe it's a combination of these things. Maybe we should start, seeing if all this stuff works together, and it does. And so I think that was sort of the shift in mindset I had over the years. And it's really changed the way I practice completely.
Was there anybody that kind of led that front? Like, was there anybody that you looked and said, wow, this guy's really changed the way that we're doing this, and that's someone I want to emulate?
Yeah, I mean, I had a lot of patients, obviously I'm not going to name them, who would come to me. I had a power lifter one time, right? One of these super strong guys, he's deadlifting, 600 pounds, whatever it is, and this, that. And I say, yeah, you really shouldn't deadlift anymore. It's not, it's not good for you.
Now, when is this in your career?
So I'm probably about 2 years out. Okay. So I'm practicing for 2 years. And, we fixed him up, helped him out. And he comes back, years later, he's doing great. And he's improving his lifts. I say, man, how is this guy? In my mind, it was like, if you have a bad back, why would you load your spine? How could that possibly work? It doesn't make sense to me. And I was told this doesn't work and so forth, but here's this guy. And then I get MRI scans. I love MRIs. I mean, whatever you want to say.
Why do you love them?
Well, I mean, they give you a lot of the story. If you have an MRI, if you come to me and I get a plain film X-ray, not really getting much from that. There's specific X-rays you can do. Like, for example, in a MRI, you're lying flat. You're not moving. On an X-ray, I can have you take one upright and leaning forward. I can see if the bones are shifting. But essentially, you're just looking at the bones, right? But when I get an MRI, I see the discs, I see the spinal cord, I see the nerve roots, I see everything.
Look how excited you are right now.
It's so cool, right?
It's like you're explaining art.
Dude, it is, right? On like the highest level. And you see people who may have had an issue, and then you come back and you get an MRI a year later. What changed? And you start to see what's going on. And then, I've had so many patients over the years that I get to follow their MRIs, I get to follow their progress, see what they're doing, what they're not doing. I don't have some original approach. I'd basically just be a moron if I didn't start seeing what's working and what's not.
Yeah, but there's an ego tied to that too, that like, I'm the doctor and I need to tell you how this works. Yeah. And had you not kind of stepped outside of that and allowed kind of the data to actually explain itself and tell you what's actually working, what the results look like, if you only attach yourself to that ego, and it kind of goes back to that point of like, there's the chiropractor, there's the PT, there's the doctor. They're all compartmentalized. That's who they are. And everyone stays in their lane. If you didn't start to blend and meld these things together, then you wouldn't be open and susceptible to changing and evolving.
Yeah. I mean, well, I don't know how you could have an ego in medicine because it is the most humbling experience. I see people every day. I'm going to see 25 people in clinic later on today, right? Sometimes I'll see people and, oh my God, their back is so bad. I say, look, you got severe stenosis, you got this extruded disc, you're weak. I think you need surgery. And I'm a very conservative guy, but I think, no, I don't want to have surgery. I'm not going to do it. Okay, I'll work with it. Come back in 6 months. They're great. Like I was so wrong, Conversely, I see some people, this is no big deal. I got you. You're going to be great. They're back in 6 months and they're like, hey man, I'm not feeling better. Humbling.
Yeah, you said that to me when you're like, there was, again, part of our conversation, like, I can't tell you how this is going to pan out. I think based off of what I see, this is going to be great for you and it's going to work, but I don't know. And just in that alone allowed me to feel like a sense of like relief in the sense where, I don't want to hear my doctor say, I don't know, but there's also the reality of like any of this shit can go sideways or go right or go wrong. And being open and being vulnerable in your own practice allows me to feel like, all right, well, I'm going to trust this professional to guide me to the best of his ability and based off your experience.
Yeah. I mean, to me, that's the most powerful statement. I don't know. Again, early on in my career, I wasn't comfortable saying that because here I am, I'm a young doctor. Maybe at that time I was 33, 34, and people are coming to see me. There's a built-in insecurity with that, right? Of course, you're seeing patients who are 40, 50, 60. They're coming to you for help. They're asking you a question. You don't want to say, I don't know. because they're already looking at you like you're this young man that came in with a backpack on. And
Right.
it's like,
You got a sandwich with an apple and a brown bag.
yeah. And people like answers.
Right.
They want to know, and they came to you for an answer. But that totally flipped for me because I became so confident telling people I don't know. And in doing that, I learned so much. There's so much we don't know. How could you say you know? They say, this is a made up kind of statistic, but they say 50% of what we taught you in medical school is going to end up being wrong. It might be close to that. Medicine is changing all the time. When I was in medical school, the genome hadn't been sequenced yet.
Right.
That's a game changer.
Right.
There's gene editing now, all these biologics, whether it's stem cells and PRP, all these things they was not a thing. Right. So if you're not keeping up with these things, and by the way, with all these therapies, the right answer is we don't know. But people don't want to hear that. They want you to dig your heels in that this is the right answer. Or it's not. And it might be the right answer for you, but not me, and vice versa.
Yeah.
There's so much individuality in medicine and there's so much nuance. So once you get comfortable saying you don't know, it takes a big load off your shoulders.
Yeah. Well, when I first got the back issue and I went to the first doctor and he gave me a strength test and he did this very conventional, like put your leg up and press your foot down. And I was like, all right. He's like, all right, it's not that weak. You're seemingly okay, like all things considered. And then an actual physical therapist reached out to me. He was like, hey, I went through the same thing. Love to have you come in. If you need any help, let me know. So I was like, all right, let's go. I'll go. And he's like, hey, did they do a strength test? I said, yeah, they had me put my foot up and do this thing. He's like, yeah, that's not going to work for you. He's like, you work out, you train. Yeah. That's not going to test your strength. Go against the wall and do a calf raise. So I went to go lift myself up with my left leg, which had the nerve issue, and I couldn't get my heel off the ground. And I was instantly I felt panic. I was like, it was almost like bench pressing and just having way too much weight on you that you can't lift off your chest. And I literally felt a sense of panic. He's like, you have to really work on that. Had I only listened to that first doctor, and he says, yeah, maybe to him, he knows better than I do in this sense. I didn't realize how weak it actually was. So had I not gone to the physical therapist or the chiropractor, maybe I would be still kind of in a position where I'm not healing, so to speak.
Mm-hmm. Yeah. And everyone's so different, right? It would be insanity to treat you the same way that I treat an 80-year-old, a teenager, or someone the same exact age as you who has completely different goals.
Right.
You can I could take 5 people that have the same exact injury, same exact. We have different treatment algorithms for all of them. Like I have to know where you're at. I don't have to want for you what I want for you. It's what you want for you. What are your goals? Where do you want to be? Okay, now I know where he wants to be. How can I get him there? It's different. Yeah.
You're like a back coach.
Yeah. I don't know.
I don't want to dilute your title, but that's a really important lens to look through things, because again, going back to that egoic aspect of being a doctor, you go through med school, you pay your dues, you're going through all the rigor of it, and you want to come out and you want to be right. You want to be the doctor, but to have the lens of saying, what are your actual goals? What do you actually want to get back to? And how can we get back to a lifestyle that you're used to is a very powerful way to approach it.
Yeah. Yeah, absolutely. And looking at people outside of, what you do, like, I'll bring up powerlifting, let's say, boy, I look at some of these people that are deadlifting 700, 800, 900 pounds. Well, they know something about spine health.
Right.
You can do that. You're doing something right, and I look at gymnasts. Oh my God, I'm amazed. So I take my kids to gymnastics now, right? My twins are going to be 7. I have a 5-year-old as well. And we go to gymnastics. I watch these kids I cannot believe it. The way they're bending and all these things. But it tells you how amazing your spine is. Like we become, once we have these back issues, we think we're fragile. We're so worried about hurting our back. But when you see people loading their spines like that, people bending their spines like that, you're made to move. You're made to do these things.
Yeah, that's what I was going to say. So we're born, right? We're born, like I do some breath work. Yeah. And when you look at a child breathe, they breathe perfectly, right? They breathe the way we're supposed to breathe. Animals breathe that way too, right? And then once they get to a certain age, you start sitting more, right? You start to breathe reverse, right? we're meant to move. We're like, when you look at kids, they do have this rubber band kind of way about them. They're like, oh, I've lost that somewhere along the line, and whether it be just due to sitting at a desk all day, culture, wear and tear, whatever it may be. But we are meant to be in this constant state of movement, and it's society seemingly that kind of dulls that down for us.
Yeah, absolutely. I mean, and it's, and sometimes you talk to someone, you say, oh, you got to sit less. And they're like, buddy, I got a 9-to-5 job that requires me to sit at this desk. And I drive a half hour there and I drive a half hour home. So right off the top, I'm sitting, I don't know, 9-10 hours a day, and I cannot change that. I need this job. This is my job. This is my livelihood, et cetera, right? So sometimes you want to give people advice that's unrealistic. You have to meet people where they're at. So, okay, you're sitting all these hours. How can we build mobility in? How can we help you? Well, we know when you're sitting all day, you're really tightening up those hip flexors, right? Your QL, your psoas. Okay, let's build some mobility work in for that to loosen that up. One of the biggest problems with sitting all day, if you touch your glutes, right? Your glutes, like right now, my glutes are soft as heck, right? Not that I have strong ones to begin with. But that's a problem because our glutes are these large muscles which are made to help us move, right? And they support our spine. So when they're weak or not being used and the muscular coordination's off, what does it do? Well, it transfers the load to the muscles of your low back. And if you touch your low back right now, if you lift up your shirt and feel those muscles, compare those to your glutes. I mean, these are like tiny, tiny muscles, right? And so what happens when those muscles fatigue, which they will, because you've been sitting all day, glutes are off, those tiny muscles in your back are going to fatigue. Where does that load then transfer? To the disc. Whereas everyone who sits have a problem. L4-5, L5-S1. Where we sit, we load those lumbar discs. I mean, that's always the issue. And we see it all the time. So you have to build mobility routines in around this. You have to build targeted glute work in for folks and hip mobility. That's usually a go-to, which works for a lot of people that sit a lot.
So if someone's sitting 8 to 10 hours a day, what is your prescription for them to do? What is your workout? Are you giving them a workout? Or you just give them like, hey, listen, set a timer and get up every 5 minutes, walk around the office, whatever it is. What are you actually telling them to do?
Yeah. So for all my patients, I'm always recommending that they get with a really good personal trainer, physical therapist, chiropractor, whoever works well with their style to have their movements coordinated. Because if I give you a workout program, right, I say, do this, do 10 squats for me, right? Whatever it is. Well, if your form is bad, you could be making mistakes. Yeah, right. Come back to me like, oh my God, I did what you said, but I'm so much worse. But let's park that. Let's say you don't have access to that. You're like, look, I'm busy. I work all day. I go home, take care of the kids, go to bed. I don't have time to drive to a physical therapist somewhere, or, it's expensive.
Right.
I don't want to go and pay a copay 3 times a week and this and that. You just tell me what to do. Okay. So 1, I want you up in the morning moving. Movement is king. So I want you walking at a bare minimum, right? For many reasons. We see the data is borne out many times. I mean, 12,000 steps a day is like, you're good, but so we want you moving. We want the blood flow going, because when you're moving, you're activating these muscles, you're turning them on, you're increasing blood flow to the lumbar musculature and the disc, which is encouraging healing there, because the discs, one of the reasons they notoriously don't heal is the blood supply is just so poor. Like it's a really arid environment. So you want that tissue getting some blood flow. 2, I want you stretching the psoas muscles.
Oh God, stretching.
You got to do it.
Stretching.
So, and I use that word stretching. It's almost become like a dirty word. Well, you see, like so many people are, don't stretch, or it's mobility, not stretch. I don't care what you call it.
Right.
But you got to loosen up that muscle, because when you're seated in that position, don't forget these muscles we're talking about attach to your lower lumbar vertebrae, L1, L4. They're pulling you into this alignment. They attach to your hip, your ilium, right? And they're pulling you there. You want to loosen that up to take that tension. I wish I had a model here. Off.
Should have brought like a skeleton or something.
It's very,
One of those old school bio class skeletons. I think I have one at home for Halloween. I should have brought it.
I need to get one.
There you go. I'll give you mine. His eyes light up. So anytime there's pain, you can have the patient.
Yeah,
there you go.
I'll ask my wife. Anything that comes into my house needs approval. Yeah, I'll say. But yeah. So you're putting pressure on that front of the disc. We want to take pressure off the front of the disc. So you're going to have to mobilize that area, and then targeted glute work. So if you're just starting out, if you're a sedentary person, right? I've never been to a gym. I'm scared to go to the gym. I don't want to go to the gym. No problem, right? Side lying hip abductors can work really well for folks as long as you're doing it controlled, short range of motion. I like to do them very slow because I like isometrics and eccentric movements because I think they're really, really good for the ligaments and tendons and so forth. Keith Barr out of UC San Diego, I believe he has done a lot of work on this, showing like a lot of ligament and tendon repair is done best isometrically. Traditionally, we had given people eccentric movements, which if you think about it, is kind of like the cousin of isometric, like, oh, go really slow or don't move at all, right?
Right. So that would be like a static stretch, like a hold stretch?
Yeah. So isometric, sorry, so I should clarify. So isometric would be static, completely static, right? A concentric movement would be if I'm curling a dumbbell, I'm moving my fist up to my shoulder, and the eccentric would be I'm lowering my fist down away from my shoulder. But so those slow movements are really good. So I'd have someone do something like a side-lying hip abductor, clamshells work for this, all these different things, glute bridges. And then for hip mobility, I like people's hips to be mobile because the more mobile your hips are, the more load you're going to take off the lower lumbar spine. That's a little bit trickier because hips are very anatomic. There are people that have something called a cam deformity. You could Google this because I don't have a diagram yet here, but where the bone kind of gets stuck in the socket. We all know people that have super mobile hips, right? And people that feel like their hips just they only go this way.
That's me.
They don't go anymore.
My hips are very tight.
Yeah. So people have super tight hips. You can still do a lot about it. You can do some controlled articular rotations. We'll build that in. So I just said a real mouthful, right? Like that was a lot. But in reality, you can do all that in 5 minutes. Everybody has 5 minutes. I'm busy. You're busy. Everyone's got 5 minutes.
Yeah, for sure.
So you can build in these little 5-minute routines in the morning, prep you for your ride. And then through the day, as you mentioned, of course, the more you can get up, the better. No one's tying you to a chair for 8 hours, I don't think. I guess you'd get in trouble for such things. Right. Well, so get up as much as you can. But then when you get home, you also got to be mobile and move too.
Yeah.
And so whatever that looks like for you.
It's when I first came to you, I'd asked you how much of this is affiliated with my tight hips, and you're like, yeah, pretty much all of it. Like a lot of it is just because, and I had my stretch of yoga and doing the pigeon pose, which was a game changer for me prior to the back injury. But I do have very tight hips, and I have the so right. I have all these things, but again, you get them, and you're like, oh, I'll use it, and then all of a sudden it just becomes something that gets stuffed away in the closet, and it does. I mean, it really does kind of, luckily I move enough, but I definitely don't move enough at the same time. And I had asked you, I was like, yeah, when I wake up in the morning, like the calf is still numb, it's still weak. The toes are still numb. You're like, you got to get up and start moving like straight away and even the physical therapist says like, you have to think of that as like a piece of floss and you have to move it to get the blood flowing to it in order for it to get like activated.
Yeah.
And it's like anything else. If you don't move it, it atrophies.
Absolutely. Yeah, absolutely. You got to move it. And it's funny too. Like if you look at, listen, I love research. I'm one of those nerds. I'm always reading science journals. Like, yeah, I've published research. By the way, I was a terrible researcher, but I do have published articles. But you shouldn't read them because they're terrible.
I'm sure they're great.
They're terrible. But, if you read the literature, they'll say like, oh, there's been no shown benefit to, flexible hamstrings, association with back pain and so forth, right? Man, I don't know anyone that's doing better with tight hamstrings. That on
That alone,
little
right?
bit.
That'll-
Anyway, like there has to be some level of common sense, right?
Yeah.
I mean, to me, so evidence-based, yes, but you also at some time have to have some experience and some, people are so locked into studies nowadays. Like they don't, even if I had this thing, right? I have this modality. Oh, studies show it's 99% effective. Well, what if you're the 1%? It didn't work for you. But here I was telling you, this is the best thing, a guarantee, right? So studies don't work that way. People really oversimplify them. And so to bring it back to that, to me, what I've seen in my practice is people that are more flexible hips, more flexible hamstrings, universally feel better. And nobody feels better with tighter hamstrings. I just haven't seen it.
Yeah.
I don't know. Maybe there's someone.
Right. Yeah, the baseline of health, and I jokingly, like, our Christmas tree's in the attic, and I have to go up and get it. And I'm like, I can't, like, I have a baseline of health that I think is pretty good. I'm like, I can't imagine if I was, like, obese or I was, like, really in pain, right? Thank God I have this baseline of health. And it gives you a moment just to reflect and be grateful for what you do have. But I'm like, I can't imagine, like, climbing up in the attic, fucking lugging the Christmas tree down, lugging it back up. Like, it would be nearly impossible.
Yeah.
It'd be nearly impossible.
Yeah.
There's a lot of books out there that bring the emotional along with the physical,
Yep.
right? There's the Body Keeps the Score. There's the book that we both had that we both were going to read at the same time. And then I got sidetracked. I can't think of the name. I have it somewhere here, but
Yeah, I haven't read it either.
but there's this correlation and this seemingly very valid point that the body reflects and expresses suppressed emotional experiences. Because, I even said to you, like, how much of this could be due to stress? How much of this could be due to this? And you're like, it can be, and it very well could be and might be, but there's also something on the MRI, on the X-ray that shows there's an actual physical thing that's happening.
Right.
So you could handle it from a psychosomatic aspect of it, but you could also handle it from a physiological aspect.
Yeah.
So what has your experience been with bringing in the psychological aspect to the back into healing?
Yeah. So what is the definition of pain, right? The definition of pain is that it is a physical and emotional experience. That is the definition. If there's no emotional component, there's no pain. People have these philosophical, battles of whether animals feel pain and so forth. Like there has to be some sensory perception of it. It's a fascinating question. I'm glad you asked it. So all right, you'll have to bear with me for one moment here.
Yeah, let's do it.
So, anyone listening, feel free to fall asleep but I'll be brief with this. So how does pain work? Let's imagine I touch a fire right now. My finger's touching fire. A signal is sensed at my fingertip. He's touching fire. It travels up a nerve to my spinal cord, up to my brain. My brain says, you're touching fire. Pull your finger back. Signal goes down my spinal cord, down the nerve root, pull my finger back.
It's amazing how fast that all happens.
So fast, right?
Like you're breaking down what's actually happening, but like think about when you touch something, you're like, oh, and you like instantly.
Yes.
Wild.
Instantaneous. Well, I mean, there's different
Thresholds.
Well, there's different nerve fibers too.
Sure.
So you'll notice, all right, if I stick my thumb on attack, you feel that initial sharp, and then you feel that throbbing aching.
Yeah.
It doesn't throb and ache initially, right?
Right.
Different nerve fibers.
Yeah.
So different nerve fibers.
Is that based off of the stimulus that it's encountering?
It's based off a different nerve fiber. So they conduct at different speeds. So there's a fiber called the A delta fiber, which is the super fast one. And then there are these C fibers, and they're slow.
What differentiates which nerve goes into action?
So it's a mess, and neuroscientists I'm a neuroscience major from undergrad, so all my old colleagues will be like, oh my God, you grossly butchered this. But it's a messy field, right? All these receptors have all these different nerve endings. They're all firing at once. In truth, there's many, many thousands of these at the same time.
Of course.
It's not one.
Of course.
But the interesting thing about this, because I promise I'm going to bring this back to your...
No, you're fine. We're good.
Is that what happens is when that signal goes to my spinal cord and to my brain, these are not passive structures. In that initial description, I made it sound like, oh, they're just, no, your brain and your spinal cord modify that signal. And this is not theory. This is not hooey stuff. This has been shown in multiple studies. I can go into them if you want. But what actually happens is you're bringing your emotional experience to this pain perception. Because as that signal is in your brain, in the many different areas of your brain, it's being modified by your emotional experience.
Modified in what regard?
The neurotransmitters are changing at different synapses and so forth. So like when these signals come, nerves talk via electricity, right? I touch something, there's a mechanical stimulus. I have receptors that sense touch, heat, cold, sharp, whatever it is. That changes to an electrical signal. The nerve conducts this electrical signal, right? Goes back to, different forms of energy in the brain. And in the brain, you have these synapses, and they release different neurotransmitters. There's different areas of the brain. So again, an oversimplification, but let's say the amygdala we always talk about is the fear center of the brain.
Right.
You'll people will put like an Alex Honnold, who, for those who don't know, free climber, does things that, just go watch the movie.
Yeah.
Wild. And they put them in fMRI machines. So we talked about MRI machines briefly before, but there's something called a functional MRI. So what does that do? Well, this is able to sequence in a different way where it can show different areas of your brain lighting up. So we'll put someone in a scanner and ask them to think of something scary, show them something scary and so forth. You can see different areas of the brain lighting.
Right.
So the amygdala is typically a fear center in the brain, right? There's obviously centers associated with anxiety, depression, all these different things. Well, these areas of the brain have been shown to influence pain signaling. And so there's a reason that if 10 of us come into this room and we put our hand in a cold ice bucket, we all go in a cold plunge, whatever it is.
Right.
We perceive that differently. I might say, this is pain for me, 7 out of 10. You might say 4 out of 10.
It's like the smiley face inside your office.
He says 10 out of 10. Hate that scale. Right. But yeah.
I got in there. I was like, I'm about a 7 right now.
I think I'm kind of smiley. I don't know.
My emotional pain? Which one is that?
Yeah, I'm physical, but I'm good now. But yeah, so that it all changes. We perceive pain differently. And a lot of research is being done right now, which I think is fascinating, of folks going in for surgeries. Their post-operative pain is largely predicated on what they're bringing to the surgery.
Mentally?
Mentally. Past traumas, anxiety, depression, all these things have really been shown to be a potent driver of post-operative pain.
Well, it would make sense. And like how quickly you're going to recover from that, right? Because if you're going into a surgery or to a scenario where you are, the baseline of you is stressed, depressed, anxious, whatever it is, it would lend itself well to be that the surgery is not going to change that part of you. And therefore the surgery and the post-surgery experience is going to go back to the pre-surgery experience, which is depression, anxiety, stress and so forth.
Absolutely. And it's correlated with later hospital discharges, higher medication use post-operatively, all these things, which is why, going back to back pain, if I hurt my shoulder today, it sucks. I hurt my knee. I'm like, I got to walk this off. I could deal with this. But when your back goes out, man, you are like, I can't move.
You wouldn't wish it upon anybody. I've experienced the back thing twice now. The first time was excruciating. Like that's the only word. I couldn't even talk. I was literally on the floor biting a blanket crying because I was it was shooting to my groin. It was beyond anything. My brain, I couldn't even comprehend what was happening. Yeah. And then this time around, not as severe, but still pretty fucking brutal. And obviously the post experience is now trying to go back into doing the normal things, jujitsu, running, whatever it is, but then also having this kind of this little voice in the background is like, don't go back to that. Like the thought of me going back to that space is terrifying.
Yeah. And that is the common experience, because the first time your back goes out like that, you can't go to work. You can't sleep. You can't take care of your family. You forget about doing things you love like jujitsu.
It wouldn't even come up on my radar.
Wouldn't even come up. And so the mental aspect becomes so huge because you are just completely terrified. Am I going to be like this forever? I need surgery. I can't live like this. I'm saying, oh my God, is this normal? Is this like, that's why the first thing you always have to do is just sit back. It's okay. Like when people come to see me in my office, I'm treating their pain by helping them mentally, by saying, look, you're going to get better. This is not permanent. You will get better. How do you know? How do I know? I've seen it in thousands of years.
Yeah, exactly.
Out of the view. It's because everyone else tells you that. Your mom tells you, you're going to be fine. Don't worry.
Right. But it's different when it's mom or dad or whatever.
I see this every day. And so you start to feel like, okay, maybe I'm going to come out of this. But then the reason I want to build this program for you is I want to give you an element of control. Because part of the fear is I have no control over this. What's going on? I can't do anything. But that's not true. You can do something. And so once you have that element of control, say, okay, I can do something about this. I know I'm going to get better. Already you're better. Because we just said that pain is those two components.
Right.
If we've already got you emotionally feeling better, you're already better. Okay, now let's get the physical better. And that comes.
Right.
But it's that first part that's the most important.
Welcome to Agora Social Club, the Westchester's hub for guys to gather, connect, and unwind. In the last 6 years, I've been facilitating a men's group called the Council of Dudes. And within that 6 years, I realized that guys need a place where they can get together, connect, and build community. A place that's not the gym, that's not jujitsu, that's not the bar, but a place where guys can come with no ego and grow and develop together. So here we have our chess table. We're going to be having monthly chess lessons and our Take a Book, Leave a Book library. Some of these I've read, some of these I haven't. Quantum physics to personal development to fiction. We also have our record player area. In the last few years, I've become very obsessed with jazz music. And if you don't know how to play vinyl, no big deal. It hooks up to your phone via Bluetooth. We have artwork from California to local artists. We have these small little work tables. So if you want to hang on the couch and get some work done, you can just come pop them open. And we also have our little workspace here with quotes from Muhammad Ali, Albert Einstein, Theodore Roosevelt. We also have our coffee bar, small fridge, and more quotes and artwork over the wall. Head on over to agorasocialclub.com, sign up for our free 7-day trial, and with that, you will get a key fob. Scan your key fob, and you have access to this space from 6 a.m. to 8 p.m., 7 days a week. So if you're a guy in the Westchester area and you're looking to gather, connect, and unwind with like-minded men, head on over to agorasocialclub.com.
I want to go back to the nerves and the firing of the nerves.
Yeah.
So you have these two different nerves. They're firing in different capacities.
More than two. But
Well, look in the scenario that we've created, right? Not to butcher it,
Yeah.
but let's dumb it down for me. So you have these nerves, and they're firing at different points. How is that in both the fMRI and the MRI? How are those being expressed, and how are those previous experiences and traumas now bleeding into the current experience?
Okay, so let's say how we can do this. We mentioned that those nerves work by a receptor being stimulated and an impulse going down the nerve.
Right.
What we didn't talk about is that those receptors have different levels required to turn them on, right? So let's make up something tangible that would make sense to somebody. Maybe I have a pressure receptor that takes 1 pound of pressure to activate it and then it goes. Maybe I have a receptor that takes 10 pounds of pressure to make it go. We already said that signal goes to your brain and spinal cord. Your brain and spinal cord modify that signal, which can then change the sensory perception of that receptor. That receptor used to not fire until 10 pounds of pressure come on. Now 1 pound sets it off. And not only does it set it off, the signal intensity is now greater. It was this, and now it's this. And this happens on a micro scale and a macro scale. And then what else happens? Once you enter the spinal cord, you have these nerves, these neurons. We call them wide dynamic range neurons. You can Google. But yeah, so they amplify signal. They change signal based on what's coming to them. So if you're somebody that's catastrophizing, which is a word we use to say, oh my, that feeling of I'm never going to get better, I'm never going to be able to walk again, all those things, you're setting off certain cascades in certain parts of your brain, which are modifying these signals to modify these nerves, to modify these receptors.
Whoa.
Yeah, I know.
So your mindset, or what you're telling yourself repeatedly, actually physically creates a relationship with that mindset and expresses itself through that language.
Physically does this. This is not theory. We have shown this multiple times on functional magnetic resonance imaging. We've shown in nerve conduction studies. I mean, this is a real thing. And this is how much medicine has changed. over the past 10 years or so, the advent of functional magnetic resonance imaging has been, Sean Mackey out of Stanford does a lot of this research for folks who want to look into it, but it's absolutely fascinating stuff. We always knew like, a positive person tends to do better and a negative person tends to.
Right. But that's just like on the surface level, right? Like not on this like neurological, front that we're seeing. Yeah. It's just kind of like, yeah, that makes sense. If you're positive, you're going to feel better. If you're negative, you're going to feel like shit.
But now we're like, wait, there's really something to this. Actually, there's something really ingrained in the central nervous system to this. And of course, without your brain, there is no pain.
So have they studied the what's ingrained in the central nervous system to make these modifications? Like, what is it about that is adapting to the mindset?
So so you have neural circuits in your brain. Like there's something called the default mode network.
Yeah.
You know it. Okay. Mm-hmm. So basically, this is like when I'm at rest, when I'm not thinking, which is never. But
right, unless you're in a sensory deprivation tank.
Just imagine you're in a sensory deprivation tank.
Love it. Have you been?
No, I haven't. Gotta do it.
Let's do it.
Gotta do it.
All right, let's do it. We'll do it together.
I'm in.
Not in the same tank, but we'll go together.
All right, good. All right, tight tank. Right, sorry. Continue. But so you have this network of nerves which are going on. They're talking in your brain, these certain areas, because your brain has all these different areas, right? There's an occipital lobe, a parietal lobe, a frontal lobe, a temporal lobe. And then within those, there's a sensory center, a motor sensor, a fear center, a movement center. If you have Parkinson's disease, right? It's a disease of the basal ganglia. If you have, there's different areas of the brain correlate with disease, right? So we all have this default mode network, but your default mode network changes when you are at a certain emotional state because you're activating different centers in your brain. You may be activating fear centers. You may be activating whatever it is, right? And so your default setting changes. And this correlates with all of pain, right? I mean, this is all ties together. And so you have these different active neural networks going on and they're changing the impulses coming in from your pain. And then you're catastrophizing and it's getting worse. And now you're really, and it's getting worse. It just snowballs.
It's a self-fulfilling prophecy.
This is how chronic pain happens. How can you be in pain for 10, 15, 20? I mean, it's horrible, right? And some people, and listen, some people, God forbid, right, have horrific injuries. You're going to have, and we all have pain. Pain is normal. No one's pain-free.
Right.
Nobody's pain-free. That's an unrealistic expectation, right? But that emotional component of it, you're in control.
That's kind of nuts. And it makes sense, right? Because you do have people that will quickly spiral at the slightest bit of WebMD research, right? Like you are WebMD and it's like, and all of a sudden you have not one thing, you have everything, right? And it's realistically speaking, how could you have all of that, right? And so much of it does correlate and relate to stress anxiety or just, like a sense of, what's the word I'm looking for? Like a hyper health anxiety, right? Like it's just exacerbated and it's out of the gate and now it's kind of running amok amongst your life.
Yeah, it's snowballing.
Yeah.
Snowball. So which is why you have to somehow, whatever that is, you have to stop that. Let's do one positive thing. If we do one positive thing, we can start moving in that direction. But if we sit in that one spot, you're just there's no end to that. That hill has no bottom. And the longer you're on it, the harder it is to come back. Doesn't mean you can't come back. You see it all the time, right? But you got to start taking control of what you can control. And the first step in that is understanding I can control something.
Yeah. I mean, when my back went out or when I had the L5S1 and it came at a time where I was very stressed, still very stressed, but I was seemingly more stressed than average. And I was doing a lot. I was doing a lot of jiu-jitsu, which again, on the external side, on the outside world, you could say, all right, well, yeah, you're doing a lot of jiu-jitsu. I wake up every morning, like my fucking hips are tight. I'd feel it. I'd go and roll and I'd be like, all right, I'm a little loose now. I'm fine. And, it was something that was very fluky. My son was having a complete meltdown from his nebulizer. And I just turned my body and I just tweaked it out in a weird way. And it was like my body knew I needed to slow down.
Yeah.
My mind would resist that idea, right? Because I'm always like, I need to do and do and do. But my body knew I needed to slow down. And you could say it was like the proverbial straw that broke the camel's back. But my body was like, gotta slow down. And it was giving me all these little, the tight hips, the whatever it was like, you need to start addressing what you're ignoring to a degree.
Yeah.
And then I just wouldn't listen to that kind of tap on my shoulder. And it was like, all right, I'm going to slow you down now. And it just snapped my back. And I was like, motherfucker. And I knew it. And again, the lens that I, of course, the first thing I was like, fuck this fucking shit. That this is miserable. But then, after a few days, I was like, oh, I needed this. Like, my body knew better than I did, and I needed this. And rather than having the approach, and maybe that's partially why I recovered the way I did, I'm not sure, but I started to lean into it as more of a blessing than anything else and say, I really need to slow the fuck down. And my body knew better than I did, and it forced me to slow down and take this different approach to things, which, again, I'm probably right back to where I was prior.
Yep.
But at least in that period, I was able to have the lens of some positivity.
Yeah. And I'm the same. We're all the same. I'm training I had a running race coming up, right? I was out for a run a few weeks ago and I rolled my ankle and I hit the ground. I'm like, oh my God, this is terrible. This is the end of the world. What I got? And it's like, dude, calm down. Yeah. I mean, it's like, but that's everybody's first response,
Yeah.
You go through this, but the back is different.
What is it about the back? Is it just because it's your back? I mean, like, and you hear, and maybe it's because I'm surrounded by a lot of guys, obviously, but is it more prevalent in men to have back issues?
No,
It's
universal.
It's
universal. Men and women get different types of back pain. We all get the same pain. Women are predisposed to different types of pain. Women have more sacroiliac joint issues, especially women who have been pregnant. They release hormones which relax the pelvis to prepare for childbirth, right?
Yeah.
But in doing so, your sacroiliac joints are these joints, the bottom of your spine is called the sacrum.
Right.
And your hip is called the ilium. So the sacroiliac joint, that joint where the hip articulates with your sacrum, they relax all the tendons and ligaments in that area for childbirth, but that can misalign the sacroiliac joint.
Is that once you become pregnant? Is that like it notifies the body like, hey, we're pregnant now, we need to start? Or is that an immediate thing, or is that over time? Is that
during pregnancy? The body's preparing to deliver a child. So
actually during actual pregnancy, not the 9 months, but like 0 hour.
Yeah, correct. So it starts. So a lot goes on in pregnancy. Don't ask me about it. I don't worry. But yeah, so women tend to have more sacroiliac joint related issues
After birth.
after birth, right?
The body doesn't go back to its previous state, or
It does, but sometimes it doesn't go back the way it was.
Sure.
Like a lot of things like that. So they can have more of those issues. But yeah, I mean, listen, they have the same exact spinal stenosis, disc herniation, facet. I mean, same things.
Yeah.
Same.
It's a loaded question, but what can people do to be, I mean, we talked about stretching, we talked about working out and living a healthy lifestyle, but what can they do on like the emotional front in conjunction with the physical to kind of seemingly prevent these things from happening?
Yeah. I mean, it's like, it's funny because when I was training in medical school, so we used to, I liked different specialties, like certain things. I was always like, oh, psychiatry. It's like, never want to do that.
You don't like it?
I'm talking about medical school.
Yeah.
And then, there was always a joke, like if someone has a heart attack at like a psychiatry event, you should still call 911. Of course. All right. Oh, they don't do real medicine, man.
Right.
That's another thing that I'm like, man, was I so freaking wrong? Like, I think they have the most important job. I think mental health is the most important thing, far more important than anything that I do, right? Like, if you're mentally good, I think you're good. So I would always, defer to the experts on that. But what have I seen work for people? Well, number one, like we talked about, showing you do have a control in this. You're not some passive person along this train that this is going to happen to and not happen to. No, you do have some control, right? And number two, just realizing, like we also just discussed, this is a human experience. This is a human experience, and it gets everyone.
That's it. I mean, everybody gets back.
I mean, if
nobody gets away from back pain.
I mean, if you,
your friends are a good field, huh?
There's no shortage, But if you look at like the data, and again, I don't think the data is good on this. It shows like lifetime prevalence of back pain, 80-90%. But how did they get that data? They call you on the phone. Hey, ever had back pain? No, it's like
Right.
What does that even mean, right? But we know, I mean, just ask your friends, ask your family. It's like, it's universal, you know? Sometimes I'll tell people, I'll think of like, you know, Ernest Shackleton. I mean, this is like by anybody's definition, one of the hardest, toughest, you know, leaders that ever lived, ever walked the face of the earth. During the endurance expedition, was bound to his tent with a bout of sciatica.
Oh,
So I sometimes I'll say to people like, look, if it could put Ernest Shackleton down, you're in good company.
yeah.
No,
100%.
You're okay. You're okay. You know, and it's, you see, you know, athletes. I mean, you know, I did my fellowship at Hospital for Special Surgery. We used to take care of a lot of the pro teams there. You know, you would see like these professional football offensive linemen. I mean, guys that you look at and you're just like, oh my God, this guy's like 6'6",
Yeah.
300 pure muscle. And he's like, man, I never had pain like that in my life. I hit the ground and my floor, couldn't get up. House could be burning down. I'd have died because I couldn't get up.
Yeah, that's where I was the first time, for sure.
You know? And so I think understanding that this is something that happens, people get better. I'm not the only one. I'm not going to lose my job. I'm still going to be a father. I'm not,
Right.
you know, I mean, you really start spiraling, right?
Yeah.
I think that's sort of the biggest thing.
Keeping yourself grounded. Yeah, the one avoids it. Yeah, there's not, I don't think there's, especially, I mean, I'm thinking about like, do I know anyone who doesn't have back, like maybe my 10-year-old, like, right? Like, young, they should be good, but anyone that's just, you start getting up in age, and is it just wear and tear? Is that just the non-maintenance aspect of it? Is that what just kind of eventually kind of pulls out that last Jenga piece?
So it's wear and tear. It's a lot of it is improper movement. You know, you mentioned sitting, but it's not just sitting, right? It's like we lift things inappropriately. That's one of the reasons why I completely flipped my stance on like powerlifting, right? Like when I was younger, like I told you, I used to tell people, you can't squat, you can't deadlift, you got a bad back. Now it's like, man, I think everyone should be doing that.
Really?
I really do. And, you know, I think it's because you train yourself. Like if you can deadlift, and I'm not saying you got to go nuts with it, but if you can deadlift a weight on a barbell, not maxing out, just, you know how to move. You know how to pick something up off the floor. You know how to set your spine. Like 2 movement patterns everybody should know. Everyone should know how to hip hinge. Everyone should know how to brace their spine. You got to know that. Lifting's the only thing that can really teach you that. Because it self-corrects. If you're doing it wrong, you'll feel you're doing it wrong. So I think lifting's a great teacher. You know, I learned that from a lot of my patients and a lot of, you know, I talk to a lot of lifters now. It's like, honestly, I learn a lot more from, don't get me wrong, I learn a lot from my medical colleagues, but I talk to physical therapists, chiropractors, I mean, everyone, because they have the answers. What works for you? What works for you? But yeah, I think movement correction is huge. Huge. So if you know how to hip hinge, you know how to brace your spine, you're going to go a long way in preventing it.
Yeah, but on the everyday picking up the Amazon package that's outside your house, your kid's crying in the crib, you know, the everyday movement, you're not going to brace yourself, right, to go and pick up whatever the thing you need to pick up is. But if you're able to do it 9 out of 10 times when you're actually in a working out setting, it would seemingly set you up to be able to take on the improper posture or movement when you are picking up your child, when you are picking up said box.
Yes, because that's another fallacy, right? So you'll see some people talk about, well, you know, you can never put your spine into flexion. You got to stay neutral spine all the time. Like that's not true either. That's not realistic for life. You should be able to move your spine through flexion, extension, through full range of motion. You know, I mean, I don't know if you should be deadlifting heavy weight with a flex spine, or, I mean, that's probably not a good idea, right? I know some people disagree with that, but for sure. But I mean, you have to move through life, as you're saying. But if you have the correct mechanics that you have down most of the time, you strengthen the right musculature that protects your spine, you know, for these movements.
Yeah.
And you make yourself more able to do them. So yeah, like you're not, like you said, like, you know, when I go out to pick out an Amazon package, I'm not like, okay, here we go.
They have like those Instagram videos, like the guy like, properly putting the stuff on the shelf and
This would be ridiculous, right? But I'm also like, sometimes, you know, there's also like the straw that broke the camel's back, right? Like if I'm getting my dishes out of my dishwasher, I always do this. I don't let my wife does it because she does it the wrong way. So I get down on the ground, I pick all the plates out, I put them on the table, and then I go up to the table and then I put them away. because I don't want to keep back and forth and back and forth. I think like it's just, over time, you are.
That's an absurd concept. That's like what?
Now, I know it's an absurd concept, right?
Yeah.
But I think things like that matter. You start seeing different movement patterns and where your spine feels good, where it doesn't.
Well, it's also like getting out of bed, right? Because I forgot where, like someone told me, but you're supposed to put your legs off the side, then kind of go to your shoulder, push yourself up. And I was like, I would never get out of bed that way. And now, like, not saying I do it very often, but there are times where I'll wake up like, all right, let me try to get out of bed that way versus just like sitting up and like rolling your back, like shifting your legs and kind of rising that way.
Yeah.
Is that an accurate way to get out of bed?
I mean, I get out of bed with like a 5-year-old draped across my forehead and like, I don't know.
Foot in your face. Yeah, I got it.
That doesn't really work.
Well, that's the other part of it. It's like, what is applicable in your actual life, right?
Right.
Sometimes you can't get out of bed that way, and that's just the way life is, or doing the dishes, right? But if you can make these small modifications and changes to your everyday life when you can, it might have a bigger longevity and shelf life than you even realize.
Yeah. I mean, and here's the other secret, right? We're all individuals. And genes play a big role in this.
Do they? Even into back pain?
Huge. In many different areas, but let me just mention one of them.
Yeah, please.
So there are some individuals in this world who were gifted by the gods to have a very wide open spinal canal. So the spinal canal is where your spinal cord comes down.
That's where you put the cortisone shot into, right?
Yeah.
That was where my whole body was like, oh, fuck.
Essentially.
Yeah. Okay, got it.
And then the nerve roots come off the side, right? Some people, if your spinal, like if this whole room was the spinal canal and I'm a spinal cord, let's say, if the wall starts to come in a little bit, meaning a disc is bulging, I got tons of room. I just move over here. Doesn't bother me. But if your spinal canal is the size of a closet, if the wall comes in even a little bit, it's too tight. So there are people that were genetically gifted with a big spinal canal, and man, they can get away with.
Are there a small percentage of people?
Smaller percentage, yeah. Well, I mean, it's a continuum,
right?
Like most things is probably like a bell curve,
right?
But if you happen to be an outlier on one end, man, you can get away with a lot. And those same people say, "Look at me, I do this. You should do this and this." Well, no, they're built a different way. There's also people that got the short end on that, right? And they really have a very tight spinal canal. We call it congenital spinal stenosis. And that's tough, But so...
Is that like the slightest thing can make a disc go?
Could. Yeah, could. So it's there's a lot of individual variability to all these things. So, but yeah, I mean, getting out of bed, how do we feel in the morning? Oh, feel stiff. Right?
Well, that was what was happening. I was like, I just feel so fucking, and then I get moving and then at the end of the day, it was just like, my leg is like completely fried.
Yeah. And why are we stiff? So we can be stiff for a lot of reasons. If you have a disc issue, a facet issue, whatever it is, your back muscles are going to compensate by tightening up. Why do they do that? Because they want you to stay alive. Right? This is like an evolutionary thing. Your spinal cord is protected by all these bones on the back. If I run my finger down your back, I feel them, right? The spinous processes. When your muscles tighten up, they pull that even tighter together. So if you have a disc issue, your spine is like, don't like this. Let's protect this even more. But paradoxically, that just makes it worse for us, right? We're super tight. So you can have a tight issue for any underlying lumbar spine issue, or you can just have a tight back, whatever it is, right? But the best thing to do is just get moving.
Right.
So get out of bed, start walking, hot shower, whatever it is, just start moving.
You hear the term herniated disc. What is actually happening in that process with the disc?
So the disc, there's a lot of, you hear the terminology very different. What's a herniated disc? What's a bulging disc?
Slip disc.
What's a slip disc? A protruding disc, right? So these are all kind of in the same family. So if you think of a lumbar disc, any disc, although the cervical ones are a little bit different, they have a soft middle and they have a more of a structured outside.
It's like a jelly donut.
That's what we always say.
Yeah.
Jelly.
Yeah.
In reality, that's not what it feels like, but it's a great analogy, right? So what's a disc bulge? If I squeeze that donut and it's kind of bulging a little bit, that's like a bulge. Herniation is more like if I squeeze it so much that the jelly comes out. Now, if the jelly is kind of leaking out, that can be more of a protrusion. But if that jelly piece actually flicks off and it's free of the donut, that's an extruded disc. Technically, we go about this. There's a paper, American College of Radiologists, I'm butchering their name, put this out in 2009, where they classify all the disc-related issues. And it basically comes down to if it's more than 25% out this way or that way, et cetera, is what it is. But to your point, the clinical aspect is who gets better, who doesn't, and why does it cause these symptoms?
Exactly.
So it causes these symptoms because when the disc comes out, there's a cascade of inflammation. Your body recognizes this as a foreign substance in the epidural space or in that area, right? Your body says, this should not be there. Let's send an immune response there.
It's like the same thing as a cold.
Same thing, right? So you get all this inflammation there and you have these nerve roots there. So these nerve roots sit in this inflammatory soup. What do? Man, they fire. Where do most of
That's crazy.
Yeah,
that's nuts.
So this is something that is a bit of a technical point, but I think it's good to understand. Sometimes the disc does pinch the nerve, does contact the nerve. That's what causes numbness, weakness, tingling. But that doesn't necessarily cause pain. I have people come to see me that do not have pain, but they have a weak or numb leg. And I say, boy, you got a big disc herniation. This doesn't hurt. No, it doesn't hurt because it's not inflamed. Conversely,
is there something that triggers that type of response versus another response?
So
is there a certain injury that happens that you say, all right, or is it just kind of up to chance?
So I think a lot of it we don't know. I don't know up to chance, but there are certain injuries, yes, that do trigger it. One example would be there's something called an annular fissure. If anyone listening has been told they have an annular fissure, a tear in their disc, that jelly donut, the outer surface is kind of like an onion peel, has layers, and you can get little nicks in those layers. When you do that, boy, that creates a lot of inflammation. These are the people that I see in my office. They do not have a big herniated disc or something like that. They are in rip-roaring pain. Oh my God, my back is killing me. Get the scan. We see the annular fissure. Those can be difficult to treat, honestly. There are certain things we can do for it, certainly. But to answer your question, there are certain things that happen to be hyper-inflammatory. So you can have someone but that person won't have the numbness, weakness, tingling.
Just the pain.
Because they don't have any compression of the nerve root. So those are two separate entities. Those symptoms are caused by two separate things. And that's another thing about spine health in general is everybody has an opinion on diets because we all eat food.
Right.
Oh, this works for me. This works for back pain's kind of the same way because like we said, everyone's got back pain. So we all say, you know what I did for my back? I did this, I did that, and it worked. And you try this, work for you. But what we're not understanding is that everyone's back pain is a lot different.
Right.
A lot different, right? Do you have a facet issue? Do you have a disc issue? Is this mild, moderate, or severe? Is it multiple levels, one level? How's your mobility around it, right? So what works for you might not work for me and so forth.
You mentioned chiropractors, and I did not realize that chiropractors, this is more recently, but that they have such a, there's a dark side of chiropractic. I didn't know this. And they're chiropractors are kind of they'll say it cures this. And I didn't realize that was something that they go about, but I have come across amazing chiropractors, one that I trust. I realize that going to a chiropractor is seemingly a form of maintenance. It's no different than anything else. It's not something you go once and you're fixed. It is a constant kind of maintenance that you have to, go and get adjusted or whatever. What are your thoughts? Because you mentioned chiropractors and actually, physical therapists, chiropractors, all having their own unique perspective that can lead to healing.
Yeah.
So what are your thoughts and how is if it has, thoughts on chiropractic shifted, especially working with the back?
Yeah, I mean, it's no different than every other field. Like, man, I can tell you some doctors that I'm like, I would never go to that guy.
Yeah.
He's terrible, and I think there's good doctors, bad doctors, good PTs, bad PTs, good chiros, bad chiros. I don't know why it is that chiropractic has somehow gotten this like dark reputation, as you say, because some of the best clinicians I know are chiropractors.
Yeah.
I know a few that I trust, I send my patients to. I also know some that I wouldn't.
Right.
Right. But, and chiropractic as a field, I think is very variable. I think your experience going to this person versus that person, I mean, these could be dramatically different experiences.
Yeah.
Dramatically different, right? So, I think there's absolutely fantastic ones, and also different ones gel with certain people, so I think you got to find what works for you.
Yeah.
But yeah, there are many that I personally recommend my patients to. I've seen some on Instagram that I love their work. I follow them. I learn from them all the time. So I'm always learning, and they'll say something. I say, oh man, that's a good point. I never thought of that.
What's an example of that, if you have one off the top of your head?
I don't really have one off the top of my head. More movement related stuff in general.
Yeah.
Maybe they'll show like a certain position or something, and it'll make sense to me. And I'll say, okay, maybe I'll start bringing that up with some patients, get some feedback, see what works.
Yeah, you're in a unique position because you, in order to test your thoughts and theories, you do need to experiment on people, and you're also dealing with people who are in a very vulnerable position, right? They're coming to you with this pain that is hindering their. I mean, I think of my wife who has scoliosis, and just people that are constantly at a disadvantage just walking around everyday life. And you do have to handle that with a certain kind of professionalism, but then you also have your own curiosities where it's like, there's like an experimental aspect of things. So how do you navigate like trying something new versus just being like, all right, let's just stick with the old, go by the book here?
Yeah. So I don't decide, you decide.
You know,
So what I do is with everybody, everything is an individual experience, right? So everyone has different risk tolerances. Everybody has different goals, So I often feel like my job is, you come to me, you have back pain. Okay, let's figure out what it is. Okay, here's our options. Lay them all out. What are the pros and cons of every option? Okay, what sounds good to you? I know what I would do. They always say, what would you do? I say, I would do this, but that doesn't mean that's what you should do. I don't know what your goals are, what your belief system is, what your personal, and I try to help you figure that out for yourself. And I just walk that road with you.
Yeah.
And that's the truth to it. I mean, I tend to be, there's also different aspects to this, right? Like if I recommend a different exercise to you, that's a lot different than recommending a different surgical procedure.
Of course. Yeah, of course. Right.
So, I mean,
You used to do glute bridges versus we need to do a full-on fusion is very different. Right.
So I'm much more comfortable trying a new thing in this realm versus this. Right. And even honestly, there's new procedures coming out all the time. I tend to be kind of a late adopter, and that's just me personally.
Like what's a new procedure that you're like,
New one I'm having a lot of success with. There's a lot of individuals who have vertebrogenic back pain, we say. And so who has that? Well, that's male 30 to 50, female 30 to 50, who tend to have axial midline back pain. So not that back pain that kind of goes into your muscles, but it's right in the middle, like right, if you can point, it's worse with flexion. So it hurts when I brush my teeth. It hurts when I put my shoes on, my socks on, right there, right? So there's something called basivertebral nerve ablation now. So what is that? There's a nerve in the vertebral body which transmits this pain. It's the nerve that feeds the disc there. It's called the basivertebral nerve. So what do? Well, we actually go in and ablate that nerve. But
so what does that actually mean?
So
what does ablating a nerve mean?
Yeah. So ablating a nerve, you'll hear people say burning the nerve.
Oh yeah. Okay.
Not really burning it, but you can think of it as that. But this is different than when you ablate a nerve in the facet. Because when you ablate a nerve in the facet, you put tiny needles down, they go down to the bone, you do your thing, you're out.
Are you like cleavering it off type of thing?
No, you're just putting needles down and they're connected to a machine that runs a current through it and heats them up and basically burns the nerve.
Oh.
Yeah.
So it's no longer being stimulated in the pain aspect of things.
That's correct. So in reality, what it does not burn the nerve. It demyelinates it. Nerves need myelin to really talk efficiently. And so that goes away.
So it shuts off the communication from the pain.
Correct. So, and the nerves remyelinate and it comes back. But what's different about this one is I actually have to hammer or mallet a trocar through the bone to get to the front. And then I put the probes through there and then I ablate the nerve through that venue. So the risk of that procedure is obviously far greater. So I'm not going to do that unless I'm very confident that this is going to be something that's going to help you. There are people in my field, God bless them, in every field of medicine who have to be the first. Someone's got to be the first. I never want to be the first. I want to see people who've been doing this for a year or two, talk to my friends. How are your outcomes? They're good. Okay, then I'll adopt it. So that would be like one example of that, where I'm a late adopter versus, as you said, give the glute bridge a try. I'm pretty comfortable with that. So nothing bad's gonna happen.
Yeah. How do you manage all of this? Like, because obviously you're a father, you're a husband, you're physically active, running, doing jujitsu yourself. How do you manage? And obviously you're in a position, in a career, in a field that takes. I mean, you're doing back surgery. You couldn't figure out the parking meter, but you're doing fucking back surgery. That's got to be another level of like focus and intensity and awareness that is like, so how do you manage all of it?
I mean, I love all of it. I love my job and I love every aspect of my life. So I love compartmentalizing it, right? So like I've set up my career, my hours in a way that I prioritize my family over everything else. That's number one. Being a father and husband trumps everything else, right? I maximize my time with my kids. It's my favorite thing to do by far.
I hear that. Yeah,
so,
absolutely.
So I do that and I enjoy getting ready for school in the morning, doing it. And then I go to work. I don't think about it, but I'm now focused on my job and I get to have these amazing conversations and meet these awesome people and really feel like I am helping them, making a difference in their life. And then, sometimes we go to the OR and that can be stressful, but I also feel like I'm the right person for the job. Like I have that confidence. I've done this enough times and this person needs this done. And if they need it done by someone, I'm confident I'm the right person for it. And if I feel like I'm not the right person for it, I refer to them to someone else.
Yeah.
I want them to have the best outcome. And then I park that and I go home and I do the other stuff.
You get on your knees and do the dishes.
That's it, man. That's it. So, I think I like that compartmentalization of life and everything. And I'm in a really good spot right now.
When you're in an operating room, right, there has to be this, I can't imagine this focus that overcomes you that must just be like next level. Is that like, are you tapping into like that flow state? Or are you just like omnipresent to your own doing and just allowing your experience and whatever else is taking part to just act?
Yeah, absolutely. I mean, you're there, you're totally focused. Sometimes, when my kids were young, you get poor sleep the night before. I was going to say like exhausted, right? And you go in, sometimes the patients be like, did you get good sleep last night, doc? And I would always say, oh, I slept like a baby. That was my way of not telling them I didn't sleep last night.
Yeah.
But they like that response.
Right, of course.
But when you start operating, you're in. You know what I mean? Like you could be so tough. This is how you go through residency. Residency is 100, some people doing 120 hours a week. It's insane. I mean, it shouldn't be.
I was going to say, is that something that you would like, is that just like a rite of passage kind of thing? Like, and it's antiquated, or is it just, it's necessary?
It's stupid.
Yeah.
It shouldn't be. It shouldn't be.
Is it like abusers abusing, right? Is like that kind of thing? Like we had to go through it, so fuck you, so do you.
There's so much of that, right? And I hate that.
Me too.
To anything. Well, we had to do this, so you have to do that. I'm like, well, that's not a good answer.
Right.
Is this making me a better physician? You should have to put in some hours because, what you're doing is important. And you do need to know how to do things when you're tired. What if you're on call? Something comes in and it depends on what you're doing in medicine, right? Like, the transplant surgeon has a much different job than the psychiatrist.
Right.
I don't know. They need to know how to operate all hours of the night and so forth. But I don't think everyone needs to do that. But you are in the zone, you are doing your thing. But I also think people sometimes because they don't do it, right? Like if people don't do jujitsu, they would probably say to you, oh my God, what are you thinking about? You're fighting this guy. And like, how are you how are you? You must be like, I'm like, no, man, I'm just having fun. Just rolling. If I see like an electrician, I'm like, how are you doing that? Like, that's starting there. I'd be so.
I don't want to touch my fuse box.
So freaking.
Yeah, totally. Absolutely.
So it's like if you've done something 1,000 times, it's just,
Yeah.
you're good.
So speaking of jujitsu, how has that, I mean, I know an ER surgeon who's been on the podcast and a very high, very prestigious heart surgeon who do jujitsu. And there's something about jujitsu for me that offers something that you just can't recreate. It's just, it's a vacuum of existence in the best kind of way. Okay. Because that was, I mean, we were talking and I think I said, oh yeah, and I trained jujitsu. You're like, oh, where? I was like, Igor's like, oh, do you know Sean? I was like, yeah, no fucking Sean. He's like, I did Sean's back surgery. I trained at Warwick. I was like, in that, I was like, this is, even prior to that, I was like, this is the guy. And then I feel like we've become best friends since then, but that just might be me. How has jujitsu kind of helped you with your practice, with what you're doing? Because it seems like it would be the counter, like everyone's getting stacked on their backs and it's a lot of wear and tear and you get mounted and, flattened out. And it would be seemingly counterintuitive to be a back surgeon and do jujitsu.
Yeah, it would be. I mean, I think, I've always, I started jujitsu in the early 2000s. And I trained a lot. I trained through medical school. I was in the city, so I used to go to the Henzo Gracie Main Academy there. And then I took a big break through residency.
You had to do your 120 hours a week.
Yeah, well, that's how, which is a shame because Mark Cerrone, I trained at Yale, and Mark Cerrone had a school right there. Oh. He's amazing. Yeah. Great. But yeah.
In hindsight, would you have still tried to train and do your residency, or would it have been possible?
That would have been rough. But I don't know. I think having kids is rougher than residency. But so, but then after that, I came back to it, and now it's something I bring my kids there. Try to bring my kids. They're a little hot cold with it. I don't force it to do anything. But for me personally, it's an activity that I can do where I go and I don't think.
Yeah.
No, there's no thinking. Right? You're just going. You're having fun. You have this camaraderie. You know what I mean? With the people there, the people that are in the room, and you're watching each other grow and you're having fun and you're testing yourself in a different way. Like I've always liked physical challenge.
Yeah.
That's always been my personal thing. Like I'm running a marathon this Sunday and then 6 days later I'm running a 50 miler. It's like I'm doing a big running week, right? And I'm doing another 100 miler in July. So I like doing these type of physical things. It's always been my outlet, my joy, So I don't think I have a much better answer than that, other than I like getting on the mats. I like the learning aspect of it, the thinking aspect of it.
Yeah.
And I've just made such great friendships with it.
Yeah. And there's the workout element of jiu-jitsu, which everybody gets a great workout. And then you have the Seans of the world who compete and they're different breeds. Like they're just a different breed of person who goes there to compete. And then for me, again, I'm a hobbyist at best, but I do love the thinky part of it. I love we were talking about before we recorded, but it is like a language. It is this language that is constantly unfolding. And, there are moments I'm sitting there and someone will show something and I'll be like, well, what's the answer to that? And it's like, it's 75 different things. And you're like, oh, and I'll look at them like fucking jujitsu, man. Like, it's just always this constant unfolding of the unknown, and it can go down any rabbit hole or any avenue.
Yes.
And it just takes you down a completely different path. And that's what I love about it. I love that headiness. I love the complexity, and I love that it's just always evolving. And the more it's quintessential, but the more you do it, the more you realize you don't know shit.
Yeah. Like everything.
Yeah. And that's the beauty behind it.
Yeah. I mean, it's like we mentioned with that, how I came to being so comfortable saying I don't know.
Right.
The more I learned I didn't know. And I mean, that's jiu-jitsu 101.
Yeah. That's life too. Like the more you realize you don't know, you're like, oh, I really don't know shit. Right.
Yeah.
And you have to get comfortable in that and be okay with that. And that's part of the growing and learning process. You mentioned the running. Mm-hmm. I've done 2 half marathons, trails, and they took me forever. But there is also something to the running that, I've experienced the runner's high. And in that moment you go, Oh, I get it.
Yeah.
I understand. So talk a little bit about like the running experience. How's that? I mean, it's similar to jujitsu for me in the sense of like you tap into this alternate state of consciousness to some degree,
Yeah.
and you're able to kind of just flow through things.
Yeah. I mean, I ran track and field since I was young. I think I did my first 5K when I was like 8 or 9 years old. So I've always been a runner. Got into triathlons for a while, and it was always trying to push the envelope. Oh, I did my first one. Now let's do an Ironman. Let's do this. Let's do that, But for now, I do ultras now because now I'm old as fucking. I'm old.
I can't imagine doing an Ironman.
Oh, you could.
So I know a few other people have done Ironmans, and it's something that's on my bucket list, if you will. And I'm just like, I could like the fucking swimming alone.
You should do ultra running.
Right? Don't you like chippers or chippers like half Ironmans or something like that? Do they call them like a chipper or something like that?
I never heard that.
There's like a half Ironman that you could do. Like
half Ironman. But you know what the problem with Ironman is? Time.
Because 16 hours, or if you're good,
you got to train on a bike. You got to swim. So you got to drive to a pool, get to a pool. Just do ultra running. Put your shoes on, go out the door. So much more for someone that's busy, career, family, all these things, but still wants to do big events. Ultra, and nothing's like ultra. Like
there's ultra trump Ironman for you.
For me, it does.
Really?
Yeah.
What's harder?
Well, anything can be hard depending on the effort you put in, right?
Yeah, fair.
You can dog a marathon. It's easy.
Right.
Ultra's a different kind of hard because you're out there, running for over 24 hours, so you get to this point where it's like midnight, 1 a.m., 2 a.m., you're out in the woods, it's pitch black, no one's around you. You're like losing your mind. Where am I right now? Did I get lost? Did I this? Did I that? And you get this magic at night where it starts getting dark, right? Or it's been dark. And then the sun starts to come up and you hear the world wake up. You start hearing some rustling in the weeds and you start hearing some chirping. Like you hear the animal world wake up and you get this awesome experience of like the second energy. But there's nothing like going more than 24 hours, I think. Yeah, I've only done it once before. I'm doing another one in July. But yeah, I love it.
And again, maybe it's just my own governor of my own mind, but the thought of doing a fucking Ironman.
It's the thought. You could do it. It's like I tell us.
Swimming, swimming 2 miles?
2.4.
2.4 miles, biking 120 miles?
112. Yeah.
Okay, I'm close. And then running a full marathon.
Yes.
Like that, the half marathon fucking nearly killed me.
But it's like it sounds like so much more than it is.
It's a lot.
It sounds like a lot more than it is.
It really does. It's like a lot, dude. It sounds, and then running an ultra is anything north of 50?
There's no like real definition, but people say anything more than a marathon.
Okay.
Something like that they call.
And you're doing 100.
Yep, doing 100.
And what is your training like for that? You just kind of like, I'm just going to put in miles in time?
Yeah, so I do one long run a week. And
what's a long run for you?
It builds as the season goes on. Right now I'm doing like 20s, something like that.
How long does it take you to run 20 miles?
3 hours, something like that.
That would be my half marathon. Like my half marathon was like 250.
That's great.
Half marathon, you're doing 20 miles.
You're in the game. You're in the game.
I get that. Okay, I get that. But in seemingly 20 miles would take me fucking a day. Like a full 20.
You'd have to run more. But yeah, you mix in some track work, some speed work. I'm like, all right, listen, this is not related to back pain, but I'm a super freaking nerd about VO2 max, cardiovascular health, lactate threshold, all that stuff. We're not going to talk about it because we'd be here for 5.
It's fine. It's cool. No, it's good.
But that is like super, super interesting to me. I mean, VO2 max is the number one metric for longevity.
Really?
Yeah. Yeah. By far. And the data bears it out. I mean, if you look at the data, it's incredible. It's the number one thing.
Really?
Yeah. Now, strength.
Why is it directly correlated with longevity?
So a lot of people speculate why that would be. But one reason is if your cardiovascular health is good, that's a good thing, right? You're probably metabolically efficient. So you probably don't have diabetes. You're not insulin resistant, so you've limited your risk of these cardiovascular outliers. You're probably not a smoker. Right. So all these different issues, but VO2 max is kind of interesting. So this is like, there's VO2. It's not just VO2 max. So what does that mean? As I'm sitting here at rest, I'm about, my VO2 is probably 5 mils per kilo per minute.
Right.
If I go to walk up steps, it goes to about 10. If I go to do XYZ, it goes to 20, 30, 40. But why that's interesting is if you bring that out to your life, if you say, well, when I'm 70, I want to be able to go up a flight of steps without being short of breath. To do that, you're going to need a VO2 max of about 25. But we know that once you hit 50, your VO2 max declines 10 to 15% per year. So it's always going to be declining. And if you want to project out, what am I going to look like as a 90-year-old? That's a metric that gets you there.
So do you study all these things? Are you measuring all of these things?
So I do. You don't have to do it. Only a super nerd like me would. But yeah, so you can get a VO2 max test. Pay 200 some odd bucks, and they have a lot of universities. There's a lot of places that have them. Lactate threshold testing, the same thing. But it's also, look, it's metabolic health is so interesting today because think about it. We have a functional measure of your metabolic health, what your lactate threshold is. I can put you at a treadmill and I can see when you start to accumulate lactate, and I know how efficient your mitochondria is. I know, right? I have biomarkers. I can do a glucose tolerance test on you, and I can see what happens to your insulin and glucose levels. So I have the biomarkers, I have the functional test, and I also have an imaging. I can get a DEXA scan for you, and I can see how much visceral fat you have. So we can understand metabolic health far greater than we were ever able to. And metabolic health is the driver of every other malady, basically, right? It increases your risk of cardiovascular disease, cancer, dementia, all of these things. So if your metabolic health is in order, you're good, And we have very, very good metrics for that now.
Is there one particular thing that you, from your research, that you would say lends itself to the best metabolic health? Is it running? Is it some form of training? Because running also, you hear, I'm not a runner. I don't even know if I run correctly, but I don't run in trucks, but, I don't know if I run correctly, but obviously there's a lot of impact on the knees, impact on the back, if not done correctly. And I don't know how many people go, I'm going to get trained in running.
Yeah.
But you do hear that as well.
Mm-hmm. I don't think it's the modality specifically. I think, anything that gets your cardiovascular, if you're bringing your heart rate up into certain levels. So I don't know if you're familiar with people talk about different zones.
Yeah, zone 1, zone 2, cardio. Yeah. Mm-hmm.
So I think if you're someone that picks an activity where you can get into a zone 2 and a real zone.
But zone 2, shockingly, is not that. Have you ever read Finding Ultra with Rich Roll?
Yes.
Okay. So he talks about this. He talks about finding zone 2 cardio, and his trainer's like, you have to get into zone 2. And he was a runner and a swimmer and all of these things. Yeah. And he's like, I'm practically walking at zone 2 cardio.
Yeah.
So it doesn't seemingly to be, you would think that you need to get to, right? You need to be in that state to really get the benefit of it. But the reality is it's like this low and slow kind of crock pot approach to your level of output.
Yeah. Yeah. And it's, for a lot of folks, especially if you were sedentary, walking might get you there.
Yeah.
If you're a high-level marathoner, you might be running 6-minute pace to be in zone 2. It's like, it's different for different folks. If you want to know your zone 2, you do a lactate threshold test. But
there's a formula too that's like your age minus something divided by whatever, and you get a rough idea. It's like rough. I think it's like certain. Like I think mine's like 120 or something like that.
Rough idea. Yeah, not spot on. Honestly, a better metric is when you go out for a run on your bike, whatever it is. This wouldn't work for a swim. You should be able to have a conversation.
Yes,
but it should be difficult. We can't talk like we're talking right now. It would be I get a sentence out and then I need to take a breath. I can talk to you, but it's going to be a little bit labored. That's a really good metric for what zone 2 is. You don't have to pay for an expensive test. Just sit in that zone. If you spend a lot of time in that zone, your metabolic health is going to go up substantially. Substantially, right? That's where your body's preferentially burning fats over carbohydrates, right? That's where your mitochondria are working very, very efficiently to generate ATP, because you generate a lot of ATP when you metabolize that way. This is why people are metabolically fit when they can do that. You fuel partition appropriately. So that zone 2 work, if you do that the majority of your time, and then you throw in some high intensity stuff here and there, and obviously strength training. The other thing I have to say, before we leave, because this is another big thing for me, is I want all my patients strength training. I don't care if you're 100 years old. And why is that? The main thing is the best way to build your bone mineral density. The best way. I have 2 surgeries tonight. I'm doing 2 kyphoplasties tonight for people who have came into the ER and had spine fractures last night. Why do they fracture? Because they have severe osteoporosis. So all of us build our bone mineral density through our 20s up to about 30, and then it plateaus, and then it starts to drop. For women more, after they go through menopause, it drops precipitously. So how can you offset this? You want to set the bar as high as you can when you're young. You have to load bone to do it. And you slow the loss of bone if you're continuing to load your bone. If you're 90 years old, this might mean you're taking a soup can and walking with, I don't care what you're doing, but your skeleton has to feel some type of load. So it's a kind of a tangential thing, but if you're doing the aerobic work, you're doing some high intensity stuff and you're throwing in strength training, man, you're hitting everything.
Yeah, I have to say, don't do any strength training right now. Mainly the modality is jiu-jitsu for me.
Yeah.
Which, depending who you're rolling with, could be strength training. But what I'm shocked at is, like, I'll look at my whoop after doing a class of jiu-jitsu and doing some handori rounds. It's like I'm just doing class. I'm doing some rounds. Yeah. And it doesn't reach the threshold that I think it would. Like, I think I'd be like, it's on a scale of 21, I think it is, or 22. I'm like, I'm going to definitely be at like a 15 right now. And then I look, it's like 8. And then I'll go out for a run and I'm like 13, 14, 15. And I'm like, what the fuck? Like, jiu-jitsu is like,
that was way hard.
Yeah. I'm like,
way hard.
I was fighting people for 45 minutes and that was way harder on paper. But again, going out in the street and running has a bigger impact on the whoop versus just rolling on the mat. Which I always find to be fascinating.
Yeah, I mean, a lot of it is in those rounds, right? There's periods where it's low, periods of exertion, comes back.
It makes sense, yeah.
Run is more of a
constant,
depending where you dial it in.
Yeah.
But yeah.
I gotta start lifting and working out. Dr. Thorp.
Let's add more stuff to your...
Yeah, let's just fucking add more shit to my schedule. Dude, thank you so much. I'm really, I really wanted to have this conversation, and you're just you're like this wealth of knowledge. And you're just a cool dude. Like, you're a regular guy. Like, that's the thing. Like, again, like back sergeant and you think like it's going to be this like, and then when we met, I was like, oh, this guy's fucking awesome. Like, what a cool guy. And I just want to have a conversation because, again, going through that experience, it sucks. Like, it just sucks. And if someone could listen to this and learn a little bit of how they can kind of offset that or prevent that seemingly or handle that with a little bit of grace, I think it's an important conversation to have. And then on top of that, in our meeting the first time, I was like, oh, this guy loves this shit. Like, and I think that's the coolest part about it is like, you are so unapologetically you in this space. And to see someone show up in this field, dealing with backs and pain and people's health and wellness, to see someone so passionate about it and so dialed in on it. And you obviously, you love it. It's just awesome to see. So thank you so much for coming on. This is an awesome conversation. I really appreciate it.
I appreciate it. It's awesome. And right back at you. I love everything you do. Since we met, I started following. So it's cool being here. You know, I watched all the things going on and I've learned a lot through listening to your podcast. So thank you for that.
Thank you very much. I really appreciate it. Thanks for coming on.
Let's hit the mat some.
Yeah, let's do it. Let's roll for sure. Let's get a run in too. I'd love to get smoked by you, but let's do it. All right. Awesome.
Thanks. Good.